everyone. Thank you so much for being here. My name is Brian Underwood. I am the beauty director of Oh, the Oprah magazine, and I'm so excited to be joined by the incredible Dr.Shereene Idriss, who is a dermatologist with Union Square Laser Dermatology in New York City. And you may know her by her sort of alter ego superhero, the Pillow Talk Derm, which has been maybe just a little bit successful on social media. So I'm really excited to be joined by her. Welcome, Dr. Idriss. Thank you so much for being here.
Thank you so much for having me. That was a very kind introduction. I don't know if my husband would agree. I think he would say the super lazy pillow talk because I'm just laying in bed. But thank you. Thank you for having me.
So, Dr. Idriss, I mean, you and I met a couple years ago. I came in to see you. We've worked on some stories together. And this was really before Pillow Talk Derm became I'm going to call it a phenomena, phenomena that it is now. And so I really wanted to sort of talk a little bit about that, how that all came about, how you develop and sort of nurture that, why you think it's so important to who you are and to educating people about dermatologic issues. So let's get started. Where did this idea come from? Take me through the kind of genesis of Pillow Talk Derm.
All right. So, I mean, it wasn't pre-thought out at all, honestly. And it kind of was a combination of many different things. First and foremost, I kept complaining to my nurse at the time, like, these people keep coming in with all of these crazy theories that they're learning online and they don't make any sense. And I was like venting to her, and she's like, you know what, Shereene, or Dr. Edith should call me. I'd say, call me Shereene. Just go online and, debunk them and you'll be done. And then I told her, there's no way. I have a fear of public speaking. I've actually never, before I started Pillow Talk Derm, I had never recorded my voice on any social media. No, because I don't like hearing myself at all. And she was like, listen, just go home, record yourself, do it once, get it over with. You'll, vent, air yourself out, and you'll be done.
And you'll be done.
Fine. Okay. I happened to be in bed when I first did my first story, and the running joke with my family is that I'm always in bed. But I come home and I lay down, and it was actually a Friday night, and I was like in bed. My husband fell asleep, and I was like, I'm going to do this now while he's sleeping. I have time. No one's watching. I had like 2 followers. So I did the first story from bed, and from that story, no joke, I got like 2 or 3 questions. And I was like, 2 or 3 questions? Like, who's watching this?
Right.
And then that looked like...
That's the thing with social media. Sometimes you just do it and it's like out there in the ether and you don't know who's really watching it.
I was like, who are these people? Like, I was like, I just thought I had my family following me and that was it. And all of a sudden it became like 20 questions and then almost like 450 questions and 200 questions. And it just snowballed, and it just became a running joke with my family because, like, of course you're in bed. Of course it's Pillow Talk because that's all you do. So it became like the Pillow Talk Derm thing. And I was like, oh, that's a catchy name. # Pillow Talk Derm in every story. And it just took a life of its own. And I remember when the first or second week after I started doing it officially as Pillow Talk Derm, which was like 3 weeks after I went on for the first time. How am I going to keep this up? Like, what am I going to keep talking about? And I'm in shock that I've actually kept it going for the past almost 2 years and a bit.
Yeah. And I mean, it's clearly resonating. You're up to 250,000 followers on Instagram. So people are hungry for this kind of information. And it's kind of a running theme I hear a lot from a lot of doctors, that really this idea of debunking really commonly held misconceptions is really something that's very important to them. Why do you think there is so much misinformation out there? And what do you think is contributing to that?
I think it's like multifactorial, to be honest. Skin, right, is obviously dermatology, medical, but then also cosmetic. And there are so many different players in the field who are entering this field, trying to dictate the conversation however they choose to dictate this conversation without strong regulations. And so people are claiming things, saying things that are not necessarily true or right or correct. And running with it from a marketing standpoint, from whatever, whether it's a social media, fame, marketing, trying to get a buzz going. And so as physicians, I think we sit back after studying for like almost 12, 13 years and we're like, what's going on. And I think with skin, it's because the same reason why I was drawn to it. People see their problems, they want to fix it, they can make a difference.
Yeah.
And so even at home, people can kind of take their skin and their issues into their own hands.
Mm-hmm.
And I think that's why so many people find it appealing to try to want to enter the space, try to want to talk about it, trying to want to change the discussion. But in that process, a lot of crap gets said and done, and it's just trying to kind of rectify the route and redirect people.
I mean, it's no surprise to me that we're at this place now where we're seeing in the beauty industry, cosmetics is shrinking a little and skincare is really experiencing this huge boon. Mm-hmm. What do you think you attribute that to, potentially?
I think it's about time. I mean, I think the US is just behind when it comes to the rest of the world in the beauty and cosmetic space. I think we saw that with the whole K-beauty trend. I think we saw that previously as well when it came to makeup, because it was in Europe. But in Europe and in the rest of the world, in Asia, people really focus on their skin before focusing on makeup. And we use makeup, we as the rest of the world uses makeup to enhance what you already have, but not to cover it. Yeah. And I think that discussion is slowly shifting. Yeah. And through this is where I think social media has been a blessing, where people are really embracing who they are, and trying to fix who they are as individuals and not trying to morph into someone else. Right. There are two groups of people. People are still trying to morph, and I'm trying to sway into be who you are, but just be
your best self.
Who you are.
Right.
Yeah, exactly.
So you mentioned a second ago that this idea of, no regulations, kind of a free for all when it comes to cosmetics, talking about, topical skincare ingredients. There's been a lot of discussion about this, particularly when it comes to sunscreen and regulations there. I think also when you think of this idea of clean beauty, there are bills before Congress about the FDA coming in and regulating more. Is that something you'd be a proponent of? More government regulation into cosmetic ingredients, into skincare, just to kind of, I think, get better information out there, more decisive information out there?
I feel like I'd be a proponent of having a science-backed community that's helping regulate it, something that is more, in line with what the science studies say, what clinical studies say, et cetera, without actually having, a hand in the money pot trying to push certain things. Yeah. I think clean beauty started off with very good intentions. I think a lot of brands out there still have very good intentions, but I do think there's a lot of this fear mongering going on. If it's not this, then it's not good. And if you're either here or you're either there, and life is not black or white, even when it comes to other issues. And there's always a gray zone in between. And I think it's those nuances which are the most important to really understand. And what bothers me is that those nuances are not taken into consideration at all. Yeah. So I think it's on the part of, people who have an authority within the field to really try to, set the record straight.
Yeah. So, you obviously, in your practice do a lot of aesthetics, but everyone, as we just sort of said, is really into skincare right now. They're almost like their own dermatologists now. Do you think that you can make a significant difference in the health and quality of your skin using topical cosmetic products?
I absolutely do. I think that we're living in a day and age where the intention is really there. The question is whether or not those products actually deliver. Yeah. I think we have a lot of resources at our fingertips. We have a lot of access to various ingredients that have been proven to make a difference. Yeah. But I think people have to realize that you cannot just read the ingredient list off of a label and think that you have become a chemist to know how it's made. Yeah. A baguette is not the same in France as it is in, no offense, Iowa. You know what I mean? Yeah. You might have flour, water, and yeast, but it's completely different. Yeah. Same goes for formulation. And this is where I myself might find myself a little confused at times. Like I read a label and I'm like, oh, this seems really great. And I use it. And I'm like, this kind of crap when I use it. And you can't really tell. So it's unfortunately a lot of trial and error. Yeah. Trust in the brand that you're using, you know, having a track record with that brand or understanding who's behind the brand, I think now more so than ever, that's going to have much more value than in prior years, where
Right.
people had this like almost like a black wall behind the brand, like no one knew it was behind it, but it was, we were told to use this.
Yeah.
I think now people want to know who's behind it. Do we trust that person or that source behind the brand?
Yeah.
And kind of go from there.
So let's circle back a little bit to social media. You know, there's a sort of a lively discussion that I've noticed online about sort of medical aesthetics. I'm sorry, medical ethics and social media. There's been a lot of talks about, you know, a specific issue about like, can, you know, doctors post pictures of themselves in swimsuits? Like we've gotten there.
Yeah.
And I'm just wondering, what your thoughts are. To me, it seems slightly sexist, to be honest. And it's a discussion that's, to be honest, to me, what my perception of it is that it's geared toward female doctors. What are any thoughts that you have about that and how a doctor can conduct themselves appropriately on social media platforms?
You know, I think you hit the nail on the head. I do think there are undercurrents of sexism in those issues.
Yeah.
You can absolutely be ethical and social at the
Yeah.
same time.
Right.
They both are not two opposite terms, that if you're ethical, then you're not a social human being. And obviously, physicians are humans first and foremost. We are not born physicians.
Yeah.
Personally, do I post myself in a bathing suit? No, because I'm not comfortable with myself being in a bathing suit. I'm not a swimsuit model. It's not who I am.
Right.
If you are comfortable doing that, then by all means, you should do you.
Yeah.
As long as you do yourself with your own integrity and you do yourself right by you.
Yeah.
No one else is to judge. That's my personal opinion. Ethically, I think you can be a physician socially on social media and still do your job very well and maintain your integrity and maintain the level of respect that you need to maintain in order to practice how you choose to practice. I don't think they are like opposites in any way, shape, or form.
Yeah. And it's also a way of kind of building your own quote unquote brand on social media. And we see a lot of professionals, whether it's makeup artists or hairstylists or, you know, doctors, sort of shaping their own image and sort of their own brand on social media. You've obviously carved out this incredibly successful niche for yourself. And we just talked about how you did that. What's some advice you might have for other professionals that are kind of looking to do the same for their own, you know, business, whether it's, you know, an artist like a makeup artist or a hairstylist or really anyone?
I think the most important thing so again, let's take a step back. I did not do this intentionally.
Yeah.
And I did not sit down with a pen and paper and say, this is how I want to be perceived.
Right.
This is what I want to do. Like that didn't happen.
Yeah.
I think my best advice, which might be a little cliche, is just be yourself.
Right.
And do it if you enjoy it.
Isn't that the lesson there? Right.
That is the lesson, because if you are doing this, trying to be portrayed as somebody else, you're going to be a slave to that image and you're going to hate it. And it's going to show. And so I feel like you have to be true to yourself as a person. Otherwise, you're going to find yourself in this world that you're only going to get stuck into more layers of covering up and you're going to feel suffocated at the end of the day. So if you can't be yourself, there's no point in doing it. And the other thing for me is I wasn't doing this to build a brand. I was just doing this to just speak up.
Yeah.
That's what I've learned, that I've actually found the most enjoyable out of this whole thing has been that when patients now come in to see me, patients I've never met, they already know who I am and where I stand.
Right. Right.
I don't need to sell them who I am. You know, whereas before when I was younger, and I said this in a podcast, I used to wear fake eyeglasses because I was so young. I used to wear stupid jewelry just to kind of like act a little bit more New York. Yeah, because I was like 28, 29 when I started, you know, and so people would always be like, are you old enough to do this? And it was always like, I felt the need to try to judge it and, you know, to basically so that they feel more comfortable with me. Now forget it. I walk in jeans and sneakers and a sweater. I'm like, all right, let's go. They already know what to expect because they already know who they're dealing with.
Yeah.
Again, it goes back to just being yourself, finding what it is that you really are passionate about and really truly enjoy talking about or, you know, discussing, and the rest will follow. I believe it.
And, you know, we're seeing with Instagram, I see a lot, at least in the medical community, we really do see dermatologists really embracing these platforms, almost being at sort of like the forefront of this kind of education through social media. Why do you think that is? Why might sort of derms be the early adopters here?
I mean, I don't know if we're the early adopters. I think we're all like, hey, what's going on? And John Dempsey said it best. I interviewed him for One Night Stand, and I love this quote. He was like, dermatologists are the original skin influencers.
Yeah.
And so it's about time that they're speaking up, and it's about time that dermatologists are raising their voices so people know that they exist and they're not this like obscure person doctor in the background. So I'm really proud of our field. I'm proud that we're actually raising our voices and speaking up and educating and, you know, being at the forefront of things when you have people who are completely unqualified,
Right.
acting like authorities, doing all these videos and having like all of this influence with no merit and no substance they're saying.
I think you hit the nail on the head, to be honest, because if you think about it, anyone, you know, with a phone these days is suddenly a skin influencer, but you don't have people out there being like heart disease influencers or kidney influencers. But, you know, it really is, that's the way it is with skincare, right? That's probably a big part of why dermatologists feel like they constantly want to like correct those mistakes.
Yeah, because it's a field that's so visible.
Yeah.
You can't see your blood pressure. And honestly, that's why I didn't go into internal medicine, because I didn't want to have to convince you that you have a blood pressure issue.
Yeah.
So if you came to me because you have a massive zit on your face, great. We both see it. Let's fix it. And I think that's the reason why skin has become such a skin-influencing game, because people all have skin. Everyone has skin. There's not one human being who doesn't have skin or hasn't had issues with their skin. And so everybody thinks, and there's a lower barrier to entry, everybody thinks that they can become authorities in the field.
Yeah.
So, I mean, I guess it's like anything, right? You can get like a $5 haircut from somebody who just took a pair of scissors and was like, let me cut your hair. And then you can go maximum haircut with somebody who's had massive training.
Yeah.
Same goes with skin.
Yeah. So, you know, a lot of our community here at Glam Hive, you know, half are like enthusiasts about style and half are actually working in the field of beauty and fashion. So for those people, the stylists, the wardrobe stylists, the makeup artists, you know, their clients have a real relationship with them, and their clients feel like they can ask them about anything. Mm-hmm. So if their clients are coming to them asking for skincare advice, what's your advice to them on how to counsel their clients properly?
I think it is okay to say, I don't know, when you know what to do. If you have a genuine way you think you can help, for sure, speak up and say this is potentially a way that you can help yourself. But I do think I have a lot of very good relationships and close relationships actually with a lot of fashion stylists, hairstylists, and makeup artists who are direct connectors to actual clients and patients. Because oftentimes they'll be on a set or on a shoot, hey, so-and-so has this, what do you think? And they'll send me a message. I'll be like, let that person come in tomorrow, let me take a look. And so I think those people within those fields who are dealing with beauty and wellness should also create a community for themselves when it comes to medical professionals and estheticians that they trust, that they can be the conduit between you know, their clients and those professionals. Because at the end of the day, we all need each other. And I refer to estheticians, I refer to makeup artists all the time. And it's an ongoing kind of connected network. This beauty world, the skin world, this whole tiny world is so interconnected that it's so important to create and to find your people that you like and trust, that you can easily connect with.
And you're so right. You know, you hear that sort of anecdotal thing over and over again, that hairstylists are sometimes ones who detect melanomas on scalps. Like they really are that first line sometimes of seeing like if things aren't right or things don't look right. So it's an important role, to be honest, right?
It's a super important role. I mean, hairstylists, makeup artists. I've had makeup artists send me patients, they have this bump on their face they can't get rid of. And it ended up being a basal cell, you know, a non-melanotic type of skin cancer, but something. And so someone else who was really looking at that person's face who really helped. I just think there's again, nuances, so much value in the nuances of being interconnected, of kind of knowing what you know and knowing what you don't, and knowing how to refer to someone else, but having that network available to you.
And Dr. Idriss, how do you see dermatologists and estheticians working together? Because I would think that that could sometimes be an almost antagonistic relationship, like I'm the doctor. How do you think you see those two fields working together?
I think people want it to be a page 6 situation where it's
Yeah,
like,
right.
oh, turf war, you know, you got the comedone, I got
These
the pimple.
facialists,
Yeah,
right?
no, I have a lot of respect for facialists. I think not all facialists are created equal.
Yeah,
And that is not all dermatologists are created equal. The same
yeah,
can be said about us.
yeah,
I think you have to find people who are not selling you snake oil. Again, I've created my own community of references within the facialists of New York City that I really love and respect,
yeah,
that I see patients to. And what I tell patients all the time is it nice to get facials? Absolutely. Do you enjoy them? If you do, good for you and keep doing it. But do you need to rely on me or any facialist to always have good skin? No.
mm,
I'm here to teach you how to get good skin.
mm,
And if you're having issues, the facialist is there to help bridge you to getting
yep,
the good skin, and then we will keep you on track.
yeah.
But unfortunately, I find that a lot of people, dermatologists and facialists included, will be like, well, you have to come here once a month, in order to make you totally, golden handcuffs stuck to us in order for you to have good skin. And that is not the case.
Yeah,
But I found the people that I love and trust, that I refer to all the time,
yeah,
to help bridge my patients, because I don't have the time or the bandwidth to see them as closely as I would like to. So then
sure.
the facialists that I like and respect, I send my patients to.
So you just mentioned a second ago, you've sort of created your own community of estheticians and facialists that you like. What are some of the qualities that are common amongst those estheticians that you like, that you really believe in, that makes them, in your estimation, a really good at their profession?
Two things: honesty,
Hmm.
and they know their shit.
Yeah.
You know,
Right.
like I have such a low BS meter that this is why I can't socialize very well when I go to parties, because I'm like half the time like or I'm sitting in the corner just like, hanging out.
Right.
But honesty and knows their shit.
Yeah.
Because if I feel, at least myself, that if I can connect with somebody, I can be like, hey, so and so, I'm sending you somebody. Don't take offense. This is what I told them, blah, blah, blah. They get it. They do it. They work with me and they do what they have to do because they know what they're doing.
Yeah.
I don't have to worry about it. But if I have to tippy toe around somebody and kind of like, because they like maybe want to sell extra, I will not send a patient there who's to go to somebody who's just trying to sell stuff to somebody.
Sell. Yeah, the hard sell. Right. So with our last sort of minutes, I kind of wanted to ask you some questions about sort of the basics of good skin and good skincare. You mentioned a while ago that you're looking for good formulations topically. Are there any cliff notes that you can share about what are generally the kind of products that you want to use as your skin starts to mature topically?
So as your skin matures, everyone's going to age, and hopefully that's the better alternative. But I do repeat this over and over: age is not a skin type.
Yeah.
We evolve, our skin condition changes, but it's not your type of skin. And so you can have a 40-year-old with dry skin the same way you can have a 40-year-old who wants to be a teenager and have acneic skin.
Mm-hmm.
And so you really have to look at the problems that you have.
Mm-hmm.
From and I don't love this word, anti-aging kind of perspective, a place, let's say you have baseline good skin, but you're trying to evolve in a healthy way as you're aging. I think there are certain things that most people should try to include and incorporate, whether it is exfoliating regularly with some sort of alpha hydroxy acid, like a glycolic or a lactic acid, that helps with the cell turnover, that also helps to produce collagen over time. A couple of times a week is always a good thing.
Mm-hmm.
Incorporating an antioxidant of some sort, because if you are living in the world that we're living in, there's so much stress around us that I do think it's good to feed your
And that's like vitamin C.
Vitamin C, vitamin E, a combination of the two. Those are probably the two biggest ones.
Yeah.
And then obviously sunscreen. And I myself wish I had listened more when I was younger.
Same here.
Like, I'm so dumb, like why? But sunscreen, from the earliest that you can possibly get used to wearing sunscreen, it's going to be your best bet as you get older. And then obviously you find yourselves the right moisturizer for your skin type as you're aging. Are you a little bit drier, a little bit oilier? Do you need something more thick, a little bit something lighter? You kind of navigate that, as you're aging in life. Oh, and retinols.
Retinol. So when it comes to, the vitamin A derivatives, do you think that, you can get pretty good results using like a topical retinol?
I think it depends what you're expecting. Expectations are what set everything apart. If you're expecting to look like a fetus because of your vitamin A topical, probably you will not get that.
Yeah.
If you're expecting to have a little bit clearer skin, smoother skin over time, then you will probably be a very happy camper. So I think it's all about expectations and what you are expecting from a product. But vitamin A, at least for myself, has done beautiful stuff for my skin. And I noticed when I don't use it, especially when I was pregnant.
Same.
Is when I'm not pregnant and I have been using it, my skin is definitely smoother, firmer. The lines are a little bit less evident, and my pigmentation is much more even. So,
and where do you where do you fall on the kind of topical over-the-counter retinol versus, prescription retinoids like Retin A?
You could throw a tank at my face and it could probably handle it at this point.
Same.
I'm like.
I don't think there's a top layer of skin left on.
I don't know. But I will say there are some over-the-counter retinols which have been really nice. And I do go back and forth with them. So in summertime, I'll go more towards retinols because it's really hot, the sun is strong, etc. In the winter, I'll go more towards a prescription strength or something a little bit thicker. But I've found that, there are different, formulations out there, things that didn't agree so well with me. Myself, where you can throw a tank on, I still got a little bit irritated from, so I didn't love necessarily that formulation. But I do think you can get a good result from over-the-counter stuff, or it's a very good starting point at least.
Sure. So aesthetics wise, and this is a question that I can't believe I still get, but I think a lot of people are still confused about the difference between fillers and neuromodulators like Botox, Dysport, and Xeomin. Can you quickly sort of clear up some of the confusion between the difference between those two things?
You know how many syringes of filler I have wasted for Pillow Talk Derm just to show the difference? There goes my paycheck.
Right.
Basically. All right. So fillers are a physical substance. All right. Whereas neuromodulators are a chemical, they're all chemicals, but are more of a liquid. Okay, let me take a step back. Fillers are a physical substance that help to either volumize, reposition volume, give back contour, give back definition to your face. It's playing with the volume of your face and the actual positioning. Whereas neuromodulators are affecting your muscle movement, how you're frowning, how you're acting surprised, how you're smiling, if you have a gummy smile, if it goes too high, if you have to lower it. And so neuromodulators are playing with your muscle movement, and the muscle movement in return, when you stop certain movement, can affect your overall facial structure. But it's not giving back volume. And so those are the two main differences in a very, bird's eye view.
So where do you generally use Botox, and when do you generally use filler?
I think it depends. I've had 28-year-olds who look like they're 50 because they have a massive furrow or they have lines. So I think for them, I'd start with Botox. But then at the same time, I've also had 30-year-olds who have 0 lines on their forehead, but dropping. And so I think you have to look at the person and see what your problem is and go from there. It's not like everybody should start with Botox. I don't believe in doing Botox when you have no lines. So I think you kind of have to look at the person in front of you, understand where they are at, what their issues are, and go from there.
All right. So final question. And again, Dr. Idriss, we so appreciate your time. This was so informative and so great. There's been so many great developments with aesthetics, lasers, no downtime, lunchtime lasers, all of this. Where do you think we're kind of headed? It seems to me we're headed in the general maintenance so that you don't have to necessarily go, so that the surgery route is not your only option. Do you agree? Is that kind of where we're headed?
I completely agree. I feel like I'm so happy because I'm living in the age of, I'm an Aquarius, but it's age of Aquarius. I'm so we're living in a time where less is more. Where it's all about doing little things over time, which is what I've always been emphasizing, where it's not, people don't expect a boom, one treatment, you're done for life, and they're realizing that's not going to happen because I'm constantly aging. But it's about doing little things. But the most important thing is finding that person that you love and trust, because that person should be the one that you stick with. Not because I'm trying to sell myself onto a patient, And I tell my patients all the time, leave if you don't like me. But it's because you don't want to piecemeal your face or your body.
Yeah.
You have different people just kind of doing stuff, and all of a sudden you have cheeks from one person and lips from someone else and eyebrows from someone else. You walk out looking like this, and that's really not what you want to be doing. So find the person that you really love and respect and trust, and have that person work with you and navigate life with you.
Amazing. Well, thank you again so much for your time. It was so good to see you. It's been
fun, Brian.
forever. And
I know. Hopefully I can hug you soon.
I know. I need a little touch up, I think.
You look great. Are you kidding? I was watching your face. It's like perfect.
And thank you everyone who tuned in to this chat. We're excited to see you back here for some of our other great panels today. And Dr. Idriss, you're the best. Thank you so much.
You.
Bye, everyone.
Bye.